Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. This is the first briefing of the day, and just before we came on the air, we learned that South Korea has confirmed 19 new COVID-19 cases on Saturday. 9 of them are local transmissions, mostly believed to be related to Itaewon cluster infections. The briefing is about to begin, so let's take a listen.
First of all, here is Mr. Son Young-Lee with the briefing on the coronavirus outbreak here in the country. Let us now begin our regular briefing for May 16th, Saturday. As of today midnight, we have 19 new cases, and in relation to the club-related cases, we have 9, and the rest are imported cases. And the total number of confirmed cases now stands at 11,037, and of them, 9,851 have been discharged following full recovery, and currently 924 people are in quarantine undergoing treatment. And we have conducted over 740,000 cases of diagnostic testings, and we have 2 more fatalities as of yesterday, with the death toll now standing at 262. We extend my deepest condolences to the deceased and the members of the bereaved families. The KCDC held a meeting today presided over by Health Minister Bang Neung-hoo, and we discussed the local government's quarantine efforts that are needed. And the Health Minister Bang also said that those who have been confirmed from the Itaewon cluster case, we have an increase of the secondary transmission and now reaches 40%. And he said that the swift diagnostic testing and contact tracing is very important. And after we practiced everyday life quarantine, this is the second weekend, and it is very important to keep our personal hygiene measures, including washing of our hands and also keeping our face masks. And the following is an update on the Itaewon Club case. And as of today midnight, the total number of confirmed cases relation to the Itaewon Club case amount to 161, and this is now spreading to other levels of the community. And this figure is subject to change among the updates. And on daily, we have seen an increase in the number of cases by 30, and we are not witnessing an exponential surge in the number of outbreak. And a total of 46,000 people have been tested in relation to the Itaewon Club case, and we are currently expanding our subject of diagnostic testings. We also established more walk-through screening centers as well as other screening clinics, and we have also advised the guidelines for the disclosure of the private information. And as for those who have visited the Itaewon clubs or the Itaewon area during this period of time, and if you have not been tested, please come to the testing centers as soon as possible. Please do not hesitate. And we also are carrying out an intensified crackdown on the nightlife entertainment venues, and we have done a monitoring of over 10,000 facilities nationwide, and this has been conducted together with the local governments as well as the police agencies, and we have put in place an administrative order amounting to 22 facilities, and we are still continuing these crackdowns for bars, karaoke rooms, and other nightlife entertainment venues during this weekend. And as for the Itaewon Club cluster infection, this shows that it is very difficult to have an effective control over the virus, especially in the clubs, which are very crowded and in closed spaces, and about 1/3 of these patients are asymptomatic, and the infection rate is very high, and this could lead to secondary or even tertiary infection within a small period of time. And the fatality rate is also very high among the seniors compared to the younger generations. And we have a high discrepancy rate in terms of the fatality rate in terms of age group. And many experts here at home and abroad say that the overcoming the COVID-19 and terminating the disease is a very impossible, and we have to be embracing ourselves for a prolonged outbreak. And the Itaewon case also shows that we need to have and cultivate new response measures against this virus. We are also seeing cluster infections in certain spaces, and especially for the churches, call centers, and indoor sports and gym facilities are also having limited transmissions among these confirmed cases. And these places are also vulnerable to high infection. However, we did not see an exponential surge in the outbreak. And these were all possible thanks to the quarantine measures that were kept by the public, including washing of the hands, keeping social distancing, as well as wearing of face masks. And all of the people who are working at these facilities they have exerted their full efforts to curb the further outbreak, like the clubs in Itaewon, and we would like to extend our deepest gratitude to all of the public as well for their dedication and cooperation in curbing the virus. And we ask for your continued cooperation going forward. And in the media, we also have many cases, and we also ask the media and the members of the press to report on these successful cases so that we can have our eyes on these successful cases. And during the weekend, I believe that many people will be going to multi-use facilities, including the churches, wedding halls, and etc. However, we need to consider the fact that this weekend is a very crucial time in curbing the further outbreak considering the incubation period of the virus coming from the Itaewon club case. And especially if you go to any indoor facilities which are crowded, we always ask you to keep personal hygiene measures, including washing of your hands and wearing of your face masks and keeping of social distances. And the next is the updates on the trilateral health minister cooperation between South Korea, Japan, and China, which was held yesterday via the virtual conference. And we have discussed measures to deal with the post-coronavirus world. And we also highlighted and agreed on the importance and the need for sharing of information between the three countries. Health Minister Bang Neung-hoo of South Korea has also highlighted that all of the three countries need to swiftly deal with the COVID-19 outbreak, and we need to revise our joint response to the outbreak sometime this latter half of the year, and to have a multilateral and joint efforts. And going forward, we will be increasing and intensifying our cooperative measures against COVID-19 by these three countries. And the next is the mentioned the updates on the self-quarantine periods. And right now, as of today, we have a total of more than 36,000 people who are on self-quarantine, and about 3,800 people are the imported cases coming from overseas. And we are also seeing more imported entries. And yesterday we had 2 breaches of the self-quarantine period, and we will be accusing one of these 2 breaches, and also a consideration of the breaches also is going under consideration. And we also have the wristbands put in place for those who breach the quarantine measures. And we ask all of those who are on self-quarantine for 14 days to comply with our quarantine measures. Thank you very much.
There you have it. We'll again be providing live coverage of the next briefing later in the afternoon. Bye for now.